Welcome back, everybody. Let's check in with ourselves right now as we have this important community conversation. Remember what Charlotte said. It's okay to not be okay, to check in with ourselves and really do the work. So this week, we are exploring solutions in the Bay Area and beyond about our young people and their mental health. And a big question I know many parents ask, I do myself, is how can I tell if my child is experiencing depression? So doctors say, look for those warning signs like self-harm, avoiding social interaction, changes in eating habits, weight loss, difficulty sleeping. Today, we spoke with a Stanford doctor about what parents should do if they are noticing these symptoms with their young ones.
I think it's very important to inform oneself about the condition that we may be talking about or the symptoms that we are talking about and what they mean. Also, it's important to model to the child self-care and wellness. To exercise, to have good nutrition, to not use drugs and alcohol, to have adequate sleep, and also stress management techniques, things like mindfulness, for example. Parents can also become engaged and communicate, like I mentioned, if those doors of communication open, but not only with the child, also with the school and other groups that can provide support, like the treatment team, for example. Parents should also be patient. Sometimes this takes time. The brain is a complex organ and it can have some difficulties. But seeking advice and help is very important, remembering that you're not alone.
The doctor there adds, there are steps that we can all take, even with the youngest children in our worlds. So as adults, sometimes we might hesitate to ask our kids how they're doing because we feel like we might be prying, or maybe don't even know what questions to ask. So how do we get our young ones to open up about what's really going on inside their hearts and their everyday lives? Psychologist and author Elisa D'Amour spoke on CBS Mornings about one way to get past those one-word, I'm fine responses.
Here's something I have discovered. It is very common for teenagers to wait until their parent or parents are in bed at night, getting ready to go to sleep, and then suddenly the kid shows up and is chatty as can be. And I was like hearing this everywhere, and I felt like, what is going on? And here's what I think is happening. Teens are organized around autonomy. They want to become increasingly independent. And so when we're asking the questions, we're calling the shots. If they wait till we're in bed, they decide if there's going to be a conversation. They decide the topic, because teens have actually said to me, at night, my parents don't ask so many questions or bring up new topics. And I'm thinking, because they're trying to go to sleep.
Right.
And then if the teenager wants the conversation over, they just say, okay, good night. Yeah. So we have to make ourselves available on their terms. And the thing that is so important is that the most powerful force for mental health in adolescence is strong relationships with caring adults. So we got to meet them more than halfway.
So we're talking solutions here. Here's one. A new mental health center is coming to San Jose. Valley Medical Center recently broke ground on a new building that's dedicated to serving kids in crisis.
We're going to have this facility right here in the middle of all the other medical facilities, because children and adults and adolescents, they need both the services together, which is integrated. And that's why it's so important.
So this whole project started because one woman saw her friends in crisis and heard their stories, sort of like Charlotte at the beginning of our broadcast. Somebody saw a need, stepped forward to address the need. And 8 years ago, this woman told county supervisors that something had to be done.
Having to go up, 100 miles, East Bay, North Bay, as far up as Marin, because they couldn't get anything here. And it's kind of sad that I knew so many. But then I volunteer with a few nonprofits, and some of them work in mental health, and they were telling me any referrals are out of the county. So I thought, well, this just isn't right.
Center to help our young people in our world on Bascom Avenue is expected to open in 2025.